So my name's Nicola Cawthorne. I've come today from Cambridge University Hospital's NHS Foundation Trust from the Clinical Engineering Department, and these are some of the devices that we have made for use within the hospital. Here I've got the patient-controlled analgesia handset. So analgesia is pain relief, and patients after they've had surgery often need pain relief, and this is a button that's attached to a syringe driver. The patient presses the button and gets a certain amount of a pain-relieving drug. But our pain team tell us that about 20% of the patients that need this device can't actually press the button. The button is here. It's quite small and it takes quite a lot of force to press, and you need control of a thumb or finger to be able to press it. So we needed to come up with a device that would make this easier to press. This was one of the early prototypes. This is the area where the button should be pressed. And the handset fits in there like that. And a lever action is used to press the button here. But as you can see, that's quite rough. And some of the patients that have been in our intensive care areas for a long while have got very thin skin, and this would damage the skin. Also, it's terrible for infection control. But it was a prototype to see how it felt, see how it looked. So then later we came up with this one, which is milled with this rubber band to hold the original handset in place. And it's a device similar to this that is now used across our trust with patients who have special needs, so that they can use this device. So this is a microsyringe which is being used at the moment in a European study that's going on within the trust. It was designed specifically for the study, and it's designed to deliver 20 microlitres of stem cells into the brain. So this will deliver 20 microlitres of fluid in 2.5 microlitre bursts. The little notch here shows how much fluid there is in. As you can see, there are no measurements on the syringe, and it pulls out like this, and then there are grooves here where the notch would be twisted to hold it in position. The fluid is delivered in 2.5 microlitre bursts at different points within a track within the brain, and there is a stereotactic frame used with this that draws the syringe out slowly, with stem cells being delivered at about every 5 millimetres through the track. And this is looking for a new treatment for Parkinson's disease. So what we're looking at is a variety of anal dilators. Now, when babies are born with Hirschsprung's disease, they have no rectum. So there is nowhere for the feces to exit the body. And therefore, if this is not corrected, the babies can die. So an anus is created surgically, and then a device like this is inserted into the anus for a few seconds at 3 points during the day, so that the newly created surgical opening doesn't heal shut. So these are the tools that have been in the past given to parents, and as you can see, they look pretty hideous. They're heavy, they're metal, and they can be really quite cold. You can see here that there are some markings as to dimensions, but this being pushed into a small child does not look very kind or very caring, and the parents don't particularly like them. So we looked at developing a new device that would be more acceptable to the parents and would still do what we wanted it to. I've got 3 different dilators here that look very different, and these are all different prototypes. So we looked at different methods of manufacturing these dilators out of plastic, because we wanted to make them single patient use. So this one was dip moulded. A brass mould was created, and then it was dipped in plastic. And if I turn it like that, you can see it's hollow. It's quite firm, but has a little bit of bend in it. This is a milled variation of the dilator, and this has been milled straight, and then it's bent using a hot oven and then doused in cold water. This is the current version of the device. The next version was 3D printed and out of a resin on a Formlabs printer. If you look along here, you can see where the structure that held the shape in the printer has been detached and cut away. This is what we're hoping to move towards. So when a clinician asked for a set of these, they could just be printed off and handed, QC'd, very important, and handed over to the clinician. And this has a solid end. So this one looks similar to the one you just saw, but instead it's hollow. And this is a decompression dilator, which allows gases out of the digestive tract. So this is a stethoscope for a doctor who had had a stroke quite early in his life, and he felt it was a very undignified process trying to put on a stethoscope with one hand. And indeed, it really is. He usually ended up with it in his eyes, and it could be quite painful putting it on. So this is just a prototype. This is not what he actually uses. There's no tape on the one he uses. The idea is that you press this down with the one hand, and the gap between the earpieces is big enough that you can then put the stethoscope around your head. And this can allow him to do his job and come back to work rather than be not working.